Hello, welcome to another episode of Clean Health. My name is Dr. Oby Coucou, a West African trained cardiologist and a member of the Endocrine and Metabolic Society of Nigeria. Today is a special day when we're looking at the prevention and control of diabetes. As you can see, the table is full so that you could get to the nitty-gritty of what to eat and how to take good care of your health. Now, we talked about the risk factors for type 2 diabetes, and we mentioned obesity, okay? Excessive weight. So if you're overweight, you need to lose weight, okay? And what does that mean? You need to do exercise at least 3 times in a week, lasting for 30 minutes, or sometimes 5 times in a week, as recommended by the World Health Organization, all right? Now, again, you could engage in what? More of standing than sitting, okay? We've talked about sitting can predispose to diabetes. So the more we stand, the less we're at risk of type 2 diabetes. Again, to control or prevent and control diabetes, early diagnosis is key, okay? Early diagnosis, early recognition of symptoms, as we mentioned in the previous episode, and then early recognition of the risk factors, okay? Identifying that you have this problem and quickly reporting yourself to see a specialist. You need to see a specialist, someone who is trained in handling such cases so that you don't have any complications and you can be managed early, okay? It's important also that you monitor your blood glucose levels. So you should buy a glucometer at home and check your blood glucose levels and monitor them. Have a blood glucose chart or a booklet where you record your glucose every morning. You record the date, the time, and then what is your level for the day. With fasting, that's when you have not eat. You wake up. When you ate last in the night, and then you woke up first thing in the morning. You check your sugar levels before you eat, and 2 hours after eating, you check it again. So these are very important to monitor your blood glucose. And also, take your medications. If your doctor prescribes drugs for you, don't shy away from taking your medications. You need to know you have to be on drugs for life. You have to be on your medications. If you need insulin, maybe if you have an infection or you need insulin at any time, do not shy away from it. Do not be afraid. Forget about the myths and the confusions you hear in the environment. Listen to your specialist. Take your medications and be serious about them, okay? Then again, another thing that is very important, which we're going to talk about today, is the nutrition. What is your diet like? You are what you eat, okay? So it's important that you take into cognizance the kind of food you eat. It's expected that a diabetic patient, he eats healthy diet, just like every normal human being. So these myths that go around saying, oh, you don't eat this, you don't eat that, you don't eat this, and so you become frustrated, you don't know what to eat anymore. It does not sell anymore. The current trend entails that you eat a balanced diet containing carbohydrate, protein, minerals, vitamins, water, and what? Fats and oil. So what is expected of a diabetic patient? You're expected to eat, there are foods you avoid totally. You don't take at all. There are foods you eat in moderation, and there are foods you are permitted to eat as much as you like. For instance, you are permitted to eat fruits and vegetables as much as you like. Vegetables, we have cabbage, we have carrots, we have cucumber, we have so many kinds of vegetables, peas, all right? So you can eat it in your salad, all right? So for instance, this is a plate of food, all right? You apportion the food. We talk about the proportion of food. The quantity of food you eat is what's emphasized on. So you should reduce the quantity of food you eat, okay? And you can permit it to eat any good food that is healthy. So for instance, now, this is a plate. I divide this plate into 3 portions. This way, halfway, which one side will contain all the vegetables. And on this other side, we divide it into 2, so into 3 parts. So this part contains your rice and beans, which is here. And then this part contains your lean meat. So this rice and beans, you have your carbohydrates, okay? And it's good to take more of complex carbohydrates, okay? What do I mean by complex carbohydrate? Carbohydrate that is not easily digestible by the small intestine. It goes to the colon straight. So those carbohydrates are not absorbed fast into the body. For instance, look at this food. You know about ofada rice. There's a rice called ofada rice. It's a kind of local rice where the back of the rice is not removed. It's very important that back is very important because it contains micronutrients. It contains micronutrients, vitamins, and minerals that are very important for your health. So it's very good you don't remove the back of certain grains, okay? So whole grains are important. Your chicken, your lean meat. Now for the chicken, for instance, in this plate of food we have chicken. You need to remove the back of your chicken. Do not eat the back. The back contains a whole lot of cholesterol. So you remove the back when you want to eat. It's not necessary that you eat the back. It's not good for your health. All right? So that's that. So this is a kind of example, an example of an apportioning of a plate or meal for a diabetic patient. You have carbohydrate, you have protein, you have vegetables, minerals, fats, and there's fat and oil which is used to prepare this. Okay, so the oil that you're using to prepare your meals should be what? Good oil, not the saturated oil. Now, what do I mean by good oil? Olive oil. So, balanced diets, we said foods to eat liberally. Fruits and vegetables. You have a portion of fruits here. So you can make your fruit salad. Now, it's not good to eat all of them at the same time because it will be a large meal. So you are permitted to eat in between meals. You can take more frequent meals in smaller portions so that the body can be able to handle the glucose load. Okay, we don't want you to put a lot of glucose into your system. All right, so if you eat this meal, for instance, for instance, you make your breakfast, all right, and your breakfast, maybe you'd want to take oatmeal, for instance, Quaker oat or oatmeal. Of course, it contains the back, which is very good. It's a high complex carbohydrate. It makes you get full easily. It makes you easily satiable. It makes you also, it reduces digestion and absorption of glucose. So the glucose load is lower when you take an oatmeal. So, or you can take Tom Brown for breakfast. Tom Brown contains, for instance, soya beans. It contains maize, guinea corn. It contains some groundnuts. And then this one contains Debino dates, which is also very good, and coconut natural flavor. It does not contain sugar. So this is it's a Tom Brown. It's called Tom Brown. The components are very important. So you need to look at your food labels and determine what is the caloric content of this food label. What is the content? That will be for another day. But this today, you just want to mention the kind of foods you can eat. Okay. So for breakfast, you can have Tom Brown. Okay. You can have a piece of bread. Okay. We talk of whole wheat or whole grains, okay? Whole grains are the kind of foods you should eat, complex carbohydrates. So you can take your bread, just a slice or two slices of bread. You can make club sandwich. You can get your lettuce, your tomato, fresh tomato, okay, for breakfast. Don't eat bread like that, okay? Take it with some vegetables. Vegetables enhance insulin activity. This is a hormone. Enhances its activity and helps it to perform better. So please, put your vegetables between your bread. Okay? Then, okay, for breakfast, you can have another thing, what is called granola. This is granola. It's a composition of cashew nuts, okay, walnuts. You have pumpkin seeds, almond seeds, coconut flakes, dried fruits. It has sunflower seeds. It has Pikachu seeds, which is very good for health. Okay, there are some of them that contain sugar. Don't go for those ones. Make sure you can even buy the ingredients and make it for yourself. Make it consistent. It's very nice. If you take it with Greek yogurt is one that doesn't have saturated fat. Okay, it doesn't have sugar in it. It's very good. It gives you a feeling. You're full. You can carry along for the day. You won't feel hungry. Okay, and it can help you even lose weight. All right, so those are good breakfast meals. Even your egg, you can sometimes do. Maybe today I want to do oatmeal and egg. Just like that. At least you have protein, carbohydrate, and that. Now, we said foods to eat as much as possible. Your fruits and vegetables, okay, and then reduce the proportion. Take it in between meals, right? So you have your apples too. You have your mango. You don't just carry a whole mango like this and put it into your tummy. It's a whole lot for you. You can just take a slice, okay, and take it in between meal. The same thing, just one apple in between meal is okay for you. You have one guava in between meal is okay, so that you help insulin to be produced and act. You have pineapple, just a little portion is good for you, as well as watermelon, a little portion. So some people will take they say, the doctor said I can eat fruits as I like. Carry this whole watermelon, sit down and start eating the whole thing. Please, I didn't say so. You just cut it and take a little portion. And you eat in between meal, not with your meal, because it will be excess glucose load. Do you understand? Now, Again, we said foods that we can eat, we should avoid completely as a diabetic. You must avoid junk food. Don't eat junk food. Don't eat refined sugars. What do I mean by refined sugars? Anything that is sugary, that you put into your mouth that is absorbed fast into your blood, is not good for your health. It will raise your blood glucose level very high. So avoid added sugar. You say, you want to make tea in the morning. You carry sugar and put in your tea. It is not good for you. Avoid chocolates. Ice cream. I know you like ice cream. You say, man, oh boy. It's just once in a while maybe. And then by then, of course, you should have a glucometer to monitor and know if you are abroad, they have a way of giving the insulin with insulin pump, and they can be able to monitor and give the insulin appropriately when they increase their caloric intake. But here in Africa, we don't have, such facilities or such pleasures. So please, if you want to take don't take your ice creams and chocolates and all that on a daily basis. Just once in a while, maybe you want to catch some fun, But please avoid them as much as possible. Anything like all this, your fruit drinks, energy drinks, sport drinks, soft drinks, malt. You say, I can take malt. No. They have sugar. Okay? Even Diet Coke. You say, Diet Coke is very good. It doesn't have sugar. It contains sugar. Research has shown. So be careful, please. All right? Avoid those ones. Then there's food you can take with moderation, which we've talked about. For instance, you want to do a lunch package, for instance. You want to take, Africans like to eat carbohydrates, starchy food. If they don't eat akpu or pounded yam, they have not started, okay? So you can take, but it's not very good for diabetics, okay? So you can take a little portion. For instance, plantain flour is good. You can use plantain flour, okay? Or, unripe plantain porridge. You can make unripe plantain porridge. It can be a good lunch with vegetable. There are a variety of vegetables you can use, right? Bitter leaf is good. Green leafy vegetables, alefo, what they call in Hausa, alefo, ugu. They are very good. You must use green leafy vegetables in your cooking. Very, very important. Okay? So on ripe plantain, you can make poundo with this. You can even use sweet potato flour to make it. Okay? And then you take a little portion, but put your vegetable soup. Your soup should be vegetable soup. And you can have a big plate. For instance, this is small. So if I have a little bit bigger plate of soup, I can fill this soup with a lot of vegetable soup. Then have a little handful, just a little of the, whether you're eating tuwo, whether you want to eat unripe plantain or you want to eat semovita, just a little portion of it, okay? If you want to do your pounded yam, you just have to measure a very small ball, all right? Please. It's not very good because pounded yam can raise your blood glucose a lot because of the starchy component of it, okay? So I think I've talked about the kind of foods that are very important that we can eat, those that we can eat sparingly and those who can eat a whole lot. About diabetes, so you must educate yourself. There are a lot of internet opportunities for you. Check up about it, read about it, visit your healthcare specialist. Okay, go for a follow-up visits in the clinics. Okay, and then do your lifestyle modification. You'll be fine. You'll be just all right like every other individual. Don't be afraid. Don't be worried. You'll be exactly fine. Thank you very much for watching this video. You can subscribe to my channel. If you've not subscribed, you can click on the like button if you want more of this, and you can lay your comments in the comment section. You can also share these videos so that a lot of people can be educated. Education is power. The application of knowledge is power. Thank you.